Good morning, Dr. Ida Khanum from Pediatric Pod Concierge Pediatrics in Bel Air, Houston. Today, the question I got was, why does my baby need a hip ultrasound? Or when does a baby need a hip ultrasound? It's more like the question. And I had a baby who joined our practice yesterday. New baby, so sweet. But she was delivered via C-section because she was presenting breech, which means bottoms or hip first. And often babies like that, if they're unable to turn them around, they have a C-section. But any baby that is born via breech, or there is a family history of having developmental dislocation of the hip, would routinely, we kind of recommend for those babies to go ahead and get a hip ultrasound done. And that's usually done at 4 to 6 weeks after birth, if when I do the exam, the baby has no abnormalities on the hip exam. And of course, if I feel any hip click or clunk when I examine the baby's hip, then we get that hip ultrasound earlier because we want to make sure, is the hip in position? Is the femur, the leg, and the hip joint appropriately positioned so that it continues to grow and develop appropriately for the baby? So that's the one that we end up getting a hip ultrasound on.